From the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
As hospitals across the region continue to see a surge in patients with COVID, the American Healthcare Association and National Center for Assisted Living has a warning.
What happens in the community happens in nursing homes.
Recent CDC data shows a spike in cases among senior citizens and staff at nursing homes around the country. The number of cases totaled just under 90,000 last week, nearly 9 times the amount from 3 weeks ago. This all comes as a big need for workers remains, with the Bureau of Labor Statistics report from last November showing nursing homes have lost almost 250,000 staff members since the pandemic began.
Hi everyone, I'm Kathy Wyatt. Welcome to the 25th season and this week's edition of Consider This. Our topic, coping with COVID fatigue. Joining us via Zoom to talk more about it are Jaylene Carpenter, President and CEO at Nebraska Healthcare Association, and Mindy Crouch. Mindy is a clinical social worker with Pando Geriatric Counseling. Thank you both so much for taking the time to visit with us today, and welcome.
Thank you.
No problem.
Jaylene, I want to start with you. Paint a picture of the ideal nursing home.
That's actually a question that I've pondered a lot throughout my career. The last 20 years I've spent in long-term care, mostly as an administrator of a nursing home. And, what I've actually come to is that an ideal nursing home is really in the eye of the beholder. Because what is important to me as a resident in my nursing home is going to be different than you, Kathy. And so to me, an ideal nursing home really is, what is the best fit for that individual. And I think what's really important to know is that an ideal nursing home is never about the amenities. It's really about that individual person and what's important to them.
And how, in your opinion, were Nebraska communities doing with what you just talked about pre the pandemic?
Pre-pandemic, our Nebraska facilities, I will say, were performing quite well. We have very high-rated 5-star facilities. There was a lot of facilities who participated in the American Healthcare Quality Awards program. We had several winners in those categories. And across the state, there was a definite commitment to, quality, and also just really that commitment to those individual Nebraskans. We have a lot of county-run, city-owned facilities that are just so dedicated to their local Nebraskans. And so pre-pandemic, I would say that we were definitely on the path of the commitment to make sure each resident had the right care at the right time.
Okay, but certainly not without its challenges, right? I mean, there's something called person-centered care that everybody is striving to achieve. Barriers, though, Jaylene, again, not in a perfect world here. What are some of the biggest challenges that these nursing homes and long-term care facilities are facing?
Absolutely. So, person-centered care is a regulation that nursing facilities have to comply with. So this idea of person-centered care has been around for a very long time. There are barriers in our current system of long-term care. So really, it's sort of a chicken and an egg. So 55% of Nebraskans who live in nursing facilities are dependent on state funding. Traditionally, state funding has underfunded the cost, roughly $40 a day. And so you have this issue of a lack of credible funding, and that then turns into the inability to attract and retain the top talent. And so you're in sort of this constant flux of appropriate funding, but then also staffing. And when you aren't able to compete in the labor market, which we'll get to how that's impacted in COVID, but those are generally the two main issues. Then you also roll into that just the increase in regulation that has occurred over time. The nursing home today looks very different than even 10 years ago. There's been so much shift in the industry that it's a really different picture than what we were used to even just 10 years ago.
Okay, and you mentioned it, but add COVID to the mix, and what happened to the industry?
I think really I would highlight two big things. there were tangible things that happened. Number one, a massive increase in cost for these facilities. You went from, having proper infection control protocols to weekly testing, PPE every day, supplies that you just didn't have, to where now that's the standard. And now in the labor crisis that we're seeing in Nebraska, but across the country, there is simply just a bidding war for staff. We are seeing agency staff charging 3 times the rate of the pre-pandemic. We've seen the state 24-hour care facilities raise wages by 40% to just attract staff. So when you're a nursing home and your revenue, right, your income source, 55% is coming from the state, and that doesn't go up, it's really hard to pivot quickly. I think what's more important, the impact of COVID. And, people ask me all the time, why are people leaving? Why did the workforce leave? Having worked in the industry, and I'm sure Mindy can touch on this, such an important part of long-term care is the joy that you get when you work in a facility. It's the smile, it's the simple touch of holding a resident's hand during a difficult time. It's hugging a family member. Those are the moments that matter when you're a caregiver and you're a team member in a long-term care facility, and COVID took that away, right? COVID took away our ability to interact in that way, and we made it a very sterile environment. And we can cite all sorts of other reasons for why team members are getting burnt out, but when you don't have that, I really think that has made a big impact on our long-term care facilities.
Well, and we're going to be talking to Mindy in just a couple of minutes, and we'll ask her more about this. But yeah, I mean, staff feeling defeated, maybe not appreciated, stressed out. So they leave, which adds another layer, right, of fatigue and sadness to the residents they were serving. And again, we'll ask Mindy. Right now, what I want to do is I want to go to this whole notion of vaccinations. Medical professionals have said vaccinations will help slow the spread of this pandemic. Now, we pulled these numbers from AARP, the weeks ending December 19th of 21, fully vaccinated. Now, as we're looking at this, Jaylene, tell us again, remind us, what does fully vaccinated mean?
Absolutely. So fully vaccinated per CMS regulations means that you have received either a single shot of the J&J, or if it's a 2 series, that you've received both shots and you're past the 2-week period. So that's what a fully vaccinated person would be. I would note that those numbers are incredibly high compared to the state of Nebraska's just general population. The general population in Nebraska is right around 60%. And so I know your graphic showed that it was at the end of December but we've seen numbers only increase. We now have over 80% of team members fully vaccinated in our facilities.
Okay,
so
wonderful.
That's amazing.
I want to go to the next slide too, because we added this whole booster idea and the importance of that. And we go to that same timeline, and we have residents at 67.3% and healthcare staff at 25.3%. And to your point, Jaylene, I'm sure those numbers have gone up, but there may be people at home wondering, okay, if this is staff and these are people that are they're interacting with our older adults, why aren't we it'd be unrealistic, I'd say, to say 100%, but why aren't we closer to 100% than that?
Yeah, so it's definitely much more complex when it comes to the boosters. So you have to kind of remember how the vaccines rolled out. So if you recall, long-term care facilities were prioritized. And so generally there was clinics. And so residents and team members, they all received the vaccine roughly the same time. Not surprisingly, there is turnover in skilled nursing facilities. And so they've experienced turnover, whereas residents remain relatively stagnant. And so a lot of those residents were able to receive the booster when first eligible. It's also complicated in the fact that we have seen staff continue to get vaccinated. Most of our residents got vaccinated at the very start, whereas staff has taken a little bit longer, right? They wanted to make sure and make the best choice for themselves. So that also moves to why boosters aren't as high in staff, because you had that 6-month wait period. You also have reinfection period where you can't get your booster for a period of time after you've potentially been reinfected. So it's a little harder of a number to quantify. But it's definitely something, because we're seeing number of vaccinations rise of fully what we consider fully vaccinated week over week, we do expect the booster number to continue to rise as well.
That's a good example of the story behind the numbers, right? So thank you for that explanation. This might be a good time to talk with viewers about the Nebraska Healthcare Association. What do you guys do?
Yeah. So we represent our nursing facilities, roughly 190 nursing facilities and 280 assisted living facilities across the state of Nebraska. And our mission is to serve those who serve. Those who work in long-term care do extraordinary work to serve our vulnerable elder seniors. And so it's our job to make sure and educate, advocate, and support on their behalf. And that's really what we do every single day.
Yeah, a job certainly made more challenging with this pandemic. I want to bring Mindy Crouch into the conversation now. Mindy, thank you so much for joining us today. Talk to us, before we do anything else, tell us about your role in senior care.
Yeah, so I am a licensed clinical social worker. So my job is to provide the mental health or talk therapy piece to persons that are inside nursing homes, assisted living, homebound patients, any sort of senior living community. So we provide the talk therapy.
Okay, talk about your perspective during this pandemic, Mindy. What, in terms of actions that you witnessed, tell us what it was like to be you going through all of this.
Well, it was amazing in some ways, because before the pandemic, telehealth was very restricted on how we could use it and when we could use it. And within a matter of weeks, it just expanded and exploded to where we were able to really get it out to people. And I have to commend nursing homes and staff and facilities for how quickly they adapted and helped all of their residents to make sure that they still got the services that they were getting before the pandemic. And so in that sense, it was excellent. You know, we were able to transition within a few weeks and really keep those talk therapy services going. But when it came to actual therapy, we really had to be creative and think outside of the box, because before, when we would do coping skills, they would be very active coping skills. Get out of your room and, go visit another resident or whatnot. And now when they're in quarantine, we really had to think of different ways to help them cope with being isolated and lonely and just going through the pandemic.
Yeah, and I want you to talk about that in a minute here. But first, I think it's really important. We have been hearing about, older adults, seniors, elderly. Many of these people represent what's called the silent generation. And again, I think it's important for us to understand who these people really are. Tell us about them, Mindy.
In my mind, they are a living, walking history book. And it just fascinates me because they lived everything that I get to read about. And so to hang out with them, I mean, it's just a complete honor. But this generation grew up during the institutionalization period when it came to mental health, where if you had any sort of nervousness, anxiety, hallucinations, anything that would be wrong, you would go to a state hospital and basically never come out. And so for them, mental health is extra stigmatized because we didn't start deinstitutionalization until, the 1960s, where we started to get into community-based programs. And so they were taught to be very stoic, hide their emotions, you don't ask for help. And so it is extra hard for them to reach out and to get that help that they need.
All right, so you mentioned it earlier in terms of ways, maybe outside the box ways to help people cope during this time, the people that you've just described for us. So what did you do, Mindy? What are you doing?
So the big thing, and this is even for the pandemic, is as we age, a lot of us will say that, we're depressed, but in reality, I think it's more grief because we have loss of house, health, home, independence. What about the loss of your animals? Those are true companions. And so when we're asking people if they want help to visit with someone and you say, you're grieving versus being depressed, it really opens up the door more for acceptance to get that help, because it's okay to grieve. It's not okay to be depressed, because unfortunately people see depression as, I've done something wrong, there's something wrong with me, I have a major mental illness, why am I pulling myself up by the bootstraps? But if you say you're grieving, because again, it's a loss of health, home, independence, whatever it may be, that's more acceptable.
Can I ask you, Mindy, it's hard to get people to open up under the best of circumstances. Do you have any advice for our viewers, especially family members who are watching? We keep hearing about how listening is so key, so critical right now in trying to help people cope. How do we get people to open up without seeming like we're prying?
Yeah, so I mean, just showing some interest in someone's life helps a lot, and not coming in acting like we know what's best for them, because none of us have been old before. So we have no idea. I mean, I can go to my kids and be like, oh, I've been your age before and don't do this or that, but we've never been old. So we have no idea, we're no experts in that area. So just showing some active interest, trying to learn from their experiences, that's huge right there.
Okay, Jaylene mentioned earlier about the staff shortage and how people are walking away because this wasn't what they got into it for. That has quite an impact on these older adults as well, to have that constant now disappear, not there any longer. Again, maybe advice for older adults who are watching, and again, their family members, when we hear that someone has left, someone like a staff person who was very important to that individual, what kind of a response can we or should we be giving to these people?
Again, it's going to be a whole nother loss for the residents all over again, because we have to remember that that's their home in the facility. We are in their home. The residents, the staff is going into the resident's home. So if they're attached and connected to that staff member, they're going to feel that loss just like they would with other losses that are in their life. So we have to show empathy for that and allow for them the opportunity to grieve the high turnover of the staff.
Okay. We have been hearing hints that perhaps, possibly, there could be more lockdowns if these numbers go, where we hope they don't go any further. Given what Jaylene described in the ideal environment and what are lockdowns really the answer, or have you had some time to think about maybe a better way to address these increasing numbers, mindful, of course, of safety and well-being?
Right. Yes, of course. So honestly, I think the trend now that I'm seeing in the facilities is that they won't go back into lockdown mode. So a lot of them have zones. It's a green zone, it's a yellow zone, it's a red zone. Sign a waiver if you're going into a red zone, understanding you can get COVID, have the proper PPE, having your N95 or what it can be. So that it's, there's a lot more communication, and there's a lot more zoning and ways that we can go in and still see our loved ones. And that seems to be the trend now. It's evolving as science is evolving. And so I think we're finding a way to get back to the activities, the socialization, and the visitations while still being safe doing it.
Okay. If there were one thing that Nebraskans could do to help make this situation more bearable for our older adults, what would that be, Mindy?
Well, I think we need to remember that our seniors were lonely and isolated long before COVID. The minute they lose their driver's license or their health starts to fail, they're isolated in their homes or their facilities. And unfortunately, we get very busy, and then we tend to not make time to visit. So if anything comes out of this pandemic, we've now experienced that isolation, that quarantine, and that loneliness, that hopefully we will take that empathy into our loved ones and remember them after the pandemic is over and after we resume our lives, that they're still lonely, they're still isolated, they've still lost their independence, health, and still need us
Yeah. We've talked quite a bit about the older adults. Of course, family are an extension of these people. What would you say to family members who are watching right now? Because I know that part of what you're doing is to help them as well, indirectly or directly.
Yeah, what would I say to family members? This, again, show interest in your loved ones. Try to reach out. Because at the end of the day, it's the relationship that matters, and we need to be able to maintain that relationship because that's what matters in the end.
Okay. Mindy, we've talked quite a bit with guests who've been on this program, especially in the midst of COVID, about lessons learned. As you look back over these past 2 years, your profession, what have you learned in this pandemic?
That relationships matters and time is short, and the situation really is what you make of it. It doesn't matter what you have or what you don't have. It's how you choose to use what you have and to make the best out of it.
Okay, thank you. And Jaylene, what about you? What lesson, I know you're relatively new to the Healthcare Association, but you've been in this realm for a long time. Looking back on your career, and especially these last 2 years, what have you learned?
One thing I've learned is that our industry is generally kind of regarded as slow to move and slow to make change. And if COVID taught us nothing, it is that we can pivot very quickly and we are adaptable and agile as an industry. And more importantly, like I'm just so proud to be a Nebraska provider because they came together. I saw, we are not competitors in this space. Facilities shared PPE when they needed it. They're calling each other for resources. We became a hub. We helped the foundation supply PPE to facilities. And there was so much support, especially on the onset, for our caregivers and the people who work there to just do the very best for our residents. So I'm just really proud to be a provider in Nebraska and to represent those who serve our seniors.
I want to spend the last 3 or 4 minutes, Jaylene, talking about what you're going to do moving forward. So you've talked about these lessons learned. What do the next few weeks, few months look like for the Nebraska Healthcare Association, especially in terms of the staffing challenges that you're facing?
So, we do get this question a lot, and there is 2 big issues. We have an immediate need. We need proper funding in order to be able to adequately pay staff to be competitive in the labor market, because right now our Medicaid funding simply is not there. We have legislation out and we have a campaign of Who Will Care for our seniors, and that really is to draw attention to just ensuring that we have funding to take care of our vulnerable population. Now that's a short-term need. Long term, it's to get the message out and to make sure people know what a rewarding and dignified profession working in long-term care is. I can tell you, for those who lived through the pandemic, they saw a lot. But when you serve an elder and you serve somebody in a facility, I promise you there is no greater joy. And it's our job, I feel like, as the association, to make sure not only support our members, but also get that message out there. I'm sure Mindy can speak to how much she's enjoyed being in the facility. You can see her face light up. That's any caregiver I talk to in long-term care. They light up when they talk about their residents. And so, that's crucial. If I have the liberty, one final point of what really comes next for us is to also ensure that the policymakers, those who have dictated, we talked about lockdowns and green zones, those are all policies coming from CMS and CDC and local health departments. And generally, they are a little slow from a risk perspective to remove those. So as we move this pandemic, hopefully into an endemic, we can start to ease those restrictions. There's nothing more than our providers want than to ease that and keep our residents safe, but also just make sure they're giving the best quality of life possible.
Okay, thank you so much. I want to ask of the two of you, maybe 30 seconds each, right? Final thoughts. What is the takeaway from this program today? Mindy, we'll start with you.
I think one thing is that we need to find a way to help our seniors have some sort of control back in their life. If they don't have control over their health care or anything like that, or their health situation, what else can they have control over? Whether it's something to eat or movie to watch, as simple as that, or something bigger. So I think having control in their life, especially in an uncontrollable situation, is helpful.
Okay, thank you. Jaylene, what about you?
My final thought is that if you know someone who works in long-term care, please say thank you. They are heroes, and we cannot forget the hard work that they do and how dedicated they are to our seniors.
Talking about coping with COVID fatigue today, Mindy Crouch and Jaylene Carpenter, thank you both so much for sharing your time and expertise and for everything that you are doing to enhance the lives of our older adults and their families. Folks wanting more information on this program can go to a number of websites, and we've also included phone numbers here: covid.cdc.gov, aarp.org/nursing-home-dashboard, dhhs.ne.gov, nehca.org. As we close, a look at scenes from the Benson area in Omaha is seen through the lens of Dee Warren, a junior at UNO. Thank you so much for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
Hi everyone, I'm Kathy Wyatt. Welcome to the first edition, the 5th edition, 9th edition, the 13th edition of a special weekly series on Consider This, COVID-19.
There's thousands of small businesses out there that frankly can't do business.
Our anticipation and our hope was that we would just be closed for 2 weeks.
In Nebraska, we lost an estimated $88 million in sales and more than 24,000 jobs.
Probably the last time that happened was 1918 during the Spanish flu.
Different facilities have adapted better or worse to this.
When the floods hit, you could go help your neighbor, and you could go to work side by side with them. Today, we can't do those things.
I think we've always had good teamwork, but now we know we need it.
If we cannot create immunity in between 60 and 70% of the population, we will never fully reopen.
This has been stressful for everybody.
This virus is not going to go away, not in any time soon.